Okay, so this is chapter 39, specialty examinations and procedures. So as I had said, the first examination we're going to talk about is ear exams. This is where the physician examines the inside of the ear, but sometimes it needs to be cleaned so that they can see the eardrum and inspect the ear canal and make sure that it's okay. So that would be where an MA comes in. They're expected to lavage or clean the ear out using water, and I will demonstrate that today in class. And then there's audiometry, which is where they actually test the ability of the ear to hear. Tympanometry, which is where they're testing the eardrum itself. And then tuning fork exams. Now, you need to be familiar with these two types of exams. There's the Rhine test and the Weber test. We will talk more about these today, but be familiar with those terms, Rhine test and Weber test. Eye examinations. Again, as medical assistants, we cannot examine, okay? But we can assist the physician with that process. So providers use an ophthalmoscope to examine the internal structures of the eye. I showed that tool to you the other day. Do you remember what it looks like? Yep, it's got like that oval on the top and it's got a light that beads into the eye and then you can see into the structure of the eye. Eye exams check vision, acuity, or color vision. We will be learning today how to do a Snellen test, which is the type of visual acuity test we're going to be doing for long distance. So this is for distance vision, okay? That's why you stand 20 feet away from the card so that you can see how well the patient sees from 20 feet. Eye irrigation procedures, I will also be demonstrating this procedure as well. If you have something stuck in your eye, it's useful to irrigate the eye, soothes the tissue, relieves inflammation, and removes foreign objects and discharge from the eye. Visual acuity is performed in a well-lighted room with no interruptions. Visual acuity is how well does that patient see. You want to test the patient with and without corrective lenses. So if you have a patient coming into your office and you're doing an eye exam on them, which you can do, you can test their visual acuity. You would have them complete the test with corrective lenses and then without. If they have contacts, do not make them remove their contacts though, for sanitary reasons. So like I said, the Snellen chart is for distance acuity. The Jaeger system is for near vision acuity. I have a Jaeger system machine, but unfortunately it is kind of old. So I'll show it to you, but I don't believe we'll get to use it. And then Ishihara plates are for color testing, color blindness. So can any of you not see the numbers inside of the color patterns? They're kind of hard to see. They're not really that clear of a picture. An 8 and a 5. So you're not colorblind, right? If you can't see the 8 or the 5, then there's definitely some kind of trick with some color in your eyes, and we would want to address that. We would want to do further testing to determine if the patient was colorblind or not. Okay, respiratory exams. So a lot of times in a medical office, you're not going to encounter these unless you work for a pulmonologist specifically, or you work for a GP or an internalist that happens to see a patient after they get discharged from the hospital and wants to make sure that the patient's lung capacity is sufficient. So respiratory exams, vital capacity tests. A vital capacity is defined as the greatest volume of air that can be expelled during a complete, slow, unforced expiration of maximum respiration or following maximum respiration. Spirometry, peak flow testing, and pulse oximetry. We actually have these spirometers up in the cupboard. We will be using these today. There's a mouthpiece for everybody so you can practice, see what it's like to blow into the spirometer. And we also have a pulse oximeter, but it does not work correctly. That is the machine that gets kind of like clamped on your finger when you're at the doctor or at the hospital that reads your pulse and then also reads what your oxygen level is. Is everybody familiar with that machine? Awesome. All right, proctologic exams. So as a medical assistant for a general physician or a general surgeon, you might encounter the need to assist with the proctologic exam. The purpose is to examine the anus, which that is spelled incorrectly. I'll have to fix that. With the anus and the interior of the rectum. It's used to diagnose hemorrhoids, fissures, and ulcerations. A lot of different instruments are used for these procedures, but all instruments and items that come in contact with the body cavity must be free from microorganisms, which is why we sterilize instruments, okay? Medical assistant is generally responsible for this task. As an MA, it's your job to make sure that the instruments you're using are sanitized and sterilized appropriately. You also have to properly position the patient, which is why we talked about positioning in the chapter before. That's why I gave you all these flashcards on Classroom so that you can see what positions patients need to be in for certain procedures. Can anybody tell me what position would be best for a proctologic exam? Sims is great. What else? Knee chest. What else? There's one more. It's like knee chest, but the bed breaks. Jackknife. Yep. Those are the ones that are best for procedures like that. If you're doing a sigmoidoscopy specifically, you would want to have the patient in a Sims position, because if you have them jackknifed or knee chest, it actually it bends the it bends the intestinal tract, so they wouldn't be able to get the scope through there. So you would want to put them in Sims position, so that leaves the intestinal tract open so they can get the scope up and through it to see what's going on inside of the sigmoid colon.
I thought they were gonna have to do the knee.
Oh, wow, that's interesting. Diagnostic examination of the anterior sigmoid colon is what a sigmoidoscopy is. Useful aid in the diagnosis of cancer of the colon, ulcerations, polyps, or tumors, bleeding, and the other lower intestinal disorders. So the sigmoidoscopy is used for diagnostic examination to make sure that if there's polyps or cancerous tissue in the colon. Does anybody have any questions on proctologic exams and your role as a medical assistant? So just to be clear, as an MA with these types of examinations, you would be responsible for sanitizing and sterilizing instruments. You would be responsible for prepping the patient and positioning the patient for the procedure, etc. Questions?